Come
here.
on, man. People don't
Right
do
here.
this right
And
here.
that little
Look.
like black balloon bubble is
Check this
the
out. I'm gonna
filler.
look. I'm gonna dissolve this. Look, I'm in a ball of filler right now. Look, check it out. You're gonna see it expand.
Because now he's pushing the hyaluronic.
All right. All right. So I'm doing what's called the signature Picasso here at Get Refreshed, where I'm just creating the best version of someone. So we just did a non-surgical rhinoplasty, but that's not the reason why I wanted you guys to see this video today. I'm actually going to show you guys how we can dissolve. And we're going to dissolve some filler that was placed underneath the tear troughs, and he's getting what's called the Tyndall effect. You see that bluish hue? That's from this light or sunlight hitting it.
Hi everyone, happy Tuesday.
Hitting it, and it's penetrating the skin, the light, and it's bouncing and refracting off the cold light suspension of the filler. You can see that it's a little bit raised too, because it drew water like a sponge. As hyaluronic acid absorbs over 1,000 times its molecular weight. And today we're going to show you how at Get Refreshed, we don't guess when it comes to your your face. We're going to use the ultrasound, and we're actually going to dissolve this old filler directly under ultrasound. Why? For many reasons. One, I want to dissolve the exogenous hyaluronic acid, the filler that somebody placed in there. I don't want to dissolve your natural hyaluronic acid. Why? Because the skin around the eye is very thin. It ages almost 25 years faster than the rest of your skin. So if I start accelerating that aging process by getting rid of the hyaluronic acid, I'm gonna make somebody look older. So I want to take care of the integrity of that skin. So we're going to do it with an ultrasound, with a cannula. The cannula is going to do two things for me. One, I can see because it's longer. It doesn't have a sharp end. I can see where it is under my ultrasound. Two, it doesn't have a sharp end. So it's going to push all the important stuff out of the way, like arteries, veins, and nerves. So there's less of a chance of bruising. And because people want to get back to their daily routine. All right, so. Whoa, look at all that filler. There's a lot of filler. See those little black little grapes? Mm-hmm. That's all filler. So somebody must have been injecting it like with a needle then, right?
Yeah.
They didn't go in there with a cannula.
No.
No, because you can see that the filler is all in different planes of tissue. Mm-hmm. He does have a blood vessel right there. That's probably the infraorbital neurovascular bundle. Mm-hmm. So that's the good thing about using the cannula. But dude, you have a lot of filler here. It's quite impressive. It's cool. Don't worry, we're gonna get rid of this, dude. We're gonna crush it. Yeah. So now with this ultrasound, what it does is it allows me to go directly into this. But this filler it doesn't look that old. You can see that it's nice and black, so it looks like new filler. Is it a year old or
less?
Less, right?
Yeah.
Yeah.
It's like so they had originally done it. It lasted a long time because naturally they're very hollow, under the eyes. But they did it like 2 years ago, and they redid it recently, like a couple months ago, and it looked fine. But then, like after you sleep and you move, and it just kind of puffed up, and then it started looking just worse, and worse, and now it's like kind of like you're gonna go in like a sniper shooter right now. Yeah, we're just gonna dissolve what we need to dissolve. Perfect. And this might get in your eye. Is that relaxed? Yeah. So one side has more than the other. This is the side that's pretty dissolved, but they redid it. That's
really?
Mm-hmm.
So
they dissolved everything.
They dissolved everything?
Everything. Because it was fucked, bro.
Okay, here we go. Alright, so I'm just grabbing pictures here. This side is not that blood compared to the other side. You see, like, this is his bone right here. And then these could be a little pockets. Also, it could be muscle here. This is hard to distinguish, but when you go on this side,
it's clear as day.
This is clear as day. That is filler. Okay. It's all good.
Yeah, it's fine.
All right, and this is going to be this should be painless. All right? Even though hyaluronidase sometimes can be very stimulating.
Mm-hmm. What is hyaluronidase?
Hyaluronidase is an enzyme that breaks down hyaluronic acid. You have 3 endogenous forms floating in your body of the hyaluronidase, and some people have more active forms of one of the 3. And this is why some people dissolve filler quite fast because they have more active forms of the hyaluronidase. All right, so check this out. I am going to go in there and all right. For $1 million, you tell me when I'm going to stick you with a needle, okay? This is what makes us different. You didn't even feel that. You have a needle in your face.
What?
Yep.
Well, I can't open my eyes, but I trust it.
You can. You can. Come on,
Here.
man. People don't
Right
do
here.
this right
And
here.
that little
Look.
like black balloon bubble is
Check this
the
out. I'm gonna
filler.
look. I'm gonna dissolve this. Look, I'm in a ball of filler right now. Look, check it out. You're gonna see it expand.
Because now he's pushing the Hyaluronidase.
Okay, you saw that?
Mm-hmm.